Hey there, I'm Maddie Gardner at the WBTV News Now Desk. Thanks for sticking with us this Thursday. We are standing by. We are waiting on Governor Roy Cooper and State Health Department Secretary Cody Kinsley to give us an update here on North Carolina's new response to COVID-19 as cases and hospitalizations continue to trend down. I was just taking a look at the North Carolina Health Department COVID-19 dashboard to get a better idea of where our metrics stand currently. You can see as of yesterday, about 1,500 COVID-19 cases were reported, but if you take a look at this graph, cases are way down from where they were just a month ago here, as we were seeing in 6,000 cases on February 16th. Also taking a look at the number of people currently hospitalized with COVID-19, you can see that number is 799, and it does look like Governor Cooper and Secretary Kinsley are stepping up to the podium, so let's listen in.
Well, good morning, everyone, and thank you for joining today's briefing. Over the past 2 years, North Carolina and the rest of the world has been through a lot. Personally, I expected many challenges as governor, but a global pandemic was not one of them. But I knew it was my job to lead, and I've done that to the best of my ability. Today, we can look forward with the belief that the worst is behind us. And as we look ahead, it's important to take stock of how far we've come. 2 years ago, the world stopped because of an extraordinarily contagious virus we knew little about. But as COVID-19 evolved, so too did our understanding of how to combat it. When this virus first reached North Carolina, we, like the rest of the world, faced daunting challenges. Remember, at the beginning, our country was short of the most basic tools. Personal protective equipment like masks and gowns were not widely available, even for the healthcare workers who were treating COVID patients, much less for the rest of us. Testing supplies for this new virus were just being created and produced, and they were in short supply. There was no vaccine and no effective treatment or cure. The sick flooded our hospitals, and doctors faced impossible treatment choices. In total, more than 23,000 North Carolinians lost their lives to this cruel virus, and their families still hurt today. Remembering the spring of 2020 and the following months evokes strong memories that are difficult and often painful to recall. But it's important for us to remember how we came together, took strong action, protected people's health, and worked to prevent our hospitals from being overwhelmed. We focused not only on saving lives, but livelihoods. During the pandemic, North Carolina was shown to be among the lowest states in both deaths and job loss per capita. We made the right choices. We got our children back in school. We kept our economy going. We saved lives. And now we turn the page on the pandemic, knowing that we have the tools for people and businesses to make the right choices for themselves. It's been almost a year since we ended the statewide mask mandate and capacity limits for businesses. Students and teachers have been in the classrooms all year, and masks are optional. And we have steadily increased the number of vaccinated and boosted North Carolinians, which is still critical for people to do to protect themselves from a virus that is still here. Over the last 2 years, we've written a history of hardship and resilience, setbacks and successes. But now we enter the next phase, one of individual responsibility, preparedness, and prosperity. It's time to chart the new course. This virus will still be with us, but it won't disrupt us. We must remain prepared for the potential of future surges, though, and this will mean some specific changes in the way we move forward from here. So I'd first like to ask Cody Kinsley, our Secretary of the Department of Health and Human Services, to come to the podium and share more about North Carolina and how we will lead with resilience going forward. Secretary Kinsley.
Thank you. As the governor said, we have worked hard to get to this moment. We are now prepared in ways that we could not have been 2 years ago. Most importantly, we have high levels of immunity among individuals, in major part due to the 75% of adults that have gotten at least one shot. We are also prepared with treatments, testing, and a robust supply of other tools. While COVID is now a threat we can manage, it has not disappeared. We will remain vigilant, and we will work to equip you with the information and tools you need to make choices that are best for you and your family. Moving forward, our approach will follow 4 core principles: empowering individuals, maintaining health system capacity, collaborating with local partners, and prioritizing equity. These principles ensure a fast and fair response that improves the health, safety, and well-being of all North Carolinians. People want to return to their normal routines, which they can do because of free and effective vaccines, boosters, and other tools that help people manage their risk. We will continue to ensure access to information and resources, especially for historically marginalized populations, people with disabilities, and older North Carolinians. Data will continue to drive our response as it has through the entire pandemic. But some metrics no longer measure the moment. Some that you are used to seeing, like the percentage of positive tests, will no longer be our focus. We have selected 7 metrics based on science for the current moment. Let's go to the slides. First, wastewater has pieces of the COVID-19 virus 4 to 6 days before the first cases are reported in the community. North Carolina was one of the first 8 states to partner with the CDC on sampling community wastewater to give us an early warning. Another early indicator that we'll continue to use is the percent of people going to emergency departments with COVID-like illness. When this metric is trending upward, we're expecting more severe illness in communities. Hospital admissions for COVID-19 tells us how strained our hospitals are becoming. When it is high, it indicates hospitals will be challenged to provide care for COVID-19 and non-COVID-19 patients. Cases remain important, even though every case is not reported. Case trends give us insight into particular communities and populations being affected by the virus. Being up to date with your vaccine is the most powerful way to reduce your risk of COVID-19. That's why booster rates help us measure protection in our communities. Understanding which variants are circulating in North Carolina informs our response and recommendations on how best to layer up protection. Variants that cause more severe illness or are more transmissible is important information to have. Finally, the CDC's community-level metric combines a number of these metrics above to give a low, medium, or high level of risk specific to your county. Beginning on March 23rd, the summary page of the COVID-19 dashboard will feature these 7 metrics. Recognizing the importance of trends over time, we will move to a weekly update. These metrics, along with your personal situation, can help inform your choices to protect yourself and your family. And they'll help us stay prepared as a state. Looking ahead, we will see periods of increased spread. You can stay prepared by keeping up to date with your vaccine, and we'll maintain a strong supply of treatments, testing, and PPE. North Carolinians have demonstrated incredible strength over the last 2 years, and we will recover stronger together. We've learned important lessons through this pandemic that we'll use to invest in our behavioral health and resilience, to focus on child and family well-being, and to build a strong and inclusive workforce to align with Secretary Sanders' efforts. I look forward to working with each of you to make a stronger recovery a reality. But finally, it's not too late to vaccinate. Visit myspot.nc.gov for more information. Governor Cooper.
Thank you, Secretary Kinsley. I appreciate all of the hard work that the North Carolina Department of Health and Human Services team has put into this planning and all of their tireless efforts alongside so many partners throughout this entire pandemic. As North Carolina navigated the health challenge, we never took our eye off of economic development. And through it all, we've continued to bring record-breaking numbers of job announcements. During this pandemic, we've learned lessons and gained efficiencies that we can take into the future. We know the pandemic has changed how we live, so we've adapted to ensure that we can continue to rise to the top when it comes to opportunities for better paying jobs. North Carolina's Commerce Secretary, Michelle Sanders, is here to discuss our administration's strategic planning for the future of our economy. Secretary Sanders?
Thank you, Governor Cooper, and thank you for your strong and steady leadership that has kept North Carolina at the top of the pack, both in terms of our response to COVID-19 and our economic recovery. This week, the Department of Commerce issued data showing that North Carolina's economic activity has recovered to pre-pandemic levels, both in terms of GDP and employment levels. North Carolina saw a record year for economic development in 2021, attracting global companies like Fujifilm, Apple, and Toyota, alongside the expansion of many homegrown businesses. We announced more than 24,000 new jobs and over $10 billion in capital investment from companies locating and expanding across our state. And we're off to another fast start in 2022, having already announced 23 economic projects this year. But we know there is more work to be done and many challenges ahead of us. That's why last year, the department released our first in talent strategic economic development plan. North Carolina has excelled in all the traditional economic development areas, and we continue to focus on them. But the pandemic taught us that conditions can change rapidly, and our workforce, businesses, and communities must be skilled enough to adapt and grow. Simply put, to continue leading the nation, we cannot rely solely on what made us successful in the past. The First in Talent plan highlights 3 key areas for continued success: our workforce, our businesses, and our communities. To prepare our people, our most important asset, we have laid out a focus on education from cradle to career, helping parents access affordable, high-quality child care, and working to make degrees and skill credentials attainable to ensure by 2030, 2 million North Carolinians have a post-secondary credential. For businesses, the plan highlights ways to boost small business recovery and wage growth, and invest in key sectors that provide critical technologies and products. And for our communities, it's more affordable housing, high-speed internet, and physical infrastructure that will attract residents, workers, entrepreneurs, and businesses. The plan lays out many more strategies that our department and our partners around the state are engaged in to ensure that North Carolina continues to lead the pack in economic development at all levels. We're excited about North Carolina's future, and we are committed to our growth and resiliency as North Carolina continues full speed ahead. Along with our partners from the Economic Development Partnership of North Carolina, we'll continue to work hand in hand to recruit businesses that will create good paying jobs for our fellow North Carolinians, and making investments to ensure our most valuable resource, our people, are prepared to fill those jobs of today and tomorrow. Thank you, Governor.
Thanks a lot, Secretary Sanders. As you can see, North Carolina is moving ahead with thoughtful plans on staying healthy, training workers for good jobs, and putting more money in the pockets of everyday North Carolinians. Although the state's economy has recovered to pre-COVID employment levels, we know families still face economic challenges. We know there's work to be done lowering costs of gas and groceries, getting everyone covered with health care, making child care more affordable, putting clean energy efficiency within reach. And we'll keep working on all of these important priorities. Even in our most difficult moments, I knew that North Carolina would come out all right because of the strength of our people. Our resilience, our determination, and our dedication to the values of community and ingenuity got us through it. This is why I never, not once, lost hope or confidence in the promise of our future. We led through this pandemic with a steady hand so that we could meet this moment ready to go. Along with Secretary Kinsley and Secretary Sanders, here with me today are Department of Health and Human Services Senior Deputy Director of Public Health, Dr. Susan Consagra, and officials from North Carolina Emergency Management. Behind the scenes, Jackie Mativier and Ron Vasquez are our Spanish language interpreters, and Monica McGee is our American Sign Language interpreter. We'll now take questions from media in the room. Got the mics on both sides there. Michael?
Hi, Governor. So I didn't hear you give any update on the state of emergency. Is that coming to an end?
So it does a couple of simple things. One, it gives flexibility to healthcare providers to help with surges that come, and it helps healthcare providers distribute vaccines and treatment to people. We presented to the General Assembly laws that they can pass so that we can end it. So, not a big deal.
Well, I guess related to that, we've been under it for 2 years now. We're using phrases like turning the page, the worst is behind us. Are we really facing an emergency anymore?
So, it's a legal tool that we are using to provide the flexibility that's needed. And when the legislature passes a law to give that flexibility that's needed, then we'll do away with it.
Related to what we're seeing going on overseas right now with cases starting to increase again in Europe and Asia, I was wondering what you all are expecting here in the United States in the next several weeks. Are we looking at a potential increase in cases here again?
Well, the first thing I would say is to get vaccinated and boosted if you haven't, because that provides you the best protection against these new variants that we're seeing across the world and what's already here now. And it's important to know that as we are turning the page on this pandemic, preparedness is going to be critical. And I'll turn it over to Secretary Kinsley to give his thoughts on that.
Thanks for the question. Absolutely, preparedness is what is most important right now. Making sure that people are up to date with their vaccine. Right now, only 53% of people fully vaccinated are up to date and have had that booster shot is an important way to stay ahead of the variants that we are seeing in Europe and other variants that will come. What we're seeing in Europe right now is the subvariant of Omicron driving increased spread. We believe it's about 30% more transmissible than Omicron itself. But the immunity from Omicron and from vaccines remains very protective against the most important thing, which is severe disease ending up in the hospital. So, we're ready for those waves. We'll remain vigilant. We'll remain communicating with North Carolina about what we're seeing as that comes.
This question may be for you, Secretary Kinsley, but with the updates on the metrics that you all are going to be doing weekly, if we have another variant that impacts us like Delta or Omicron or something like that, will you all be updating that any more frequently in that kind of scenario, or will it stay weekly?
We're going to remain nimble to make sure that the public has the information that they need, and we'll evaluate those situations as they come and work quickly.
And I just had one last question for the governor, just on a different topic. We've seen with rising gas prices, several states moving to waive or suspend their gas tax for a while. Is that something you have thought any more about in the last several days, and anything you would support or oppose?
Well, I'm encouraging increased domestic production, and our administration, the president and his administration, negotiating with other countries to increase production in North Carolina. What I'm concerned about with that is making sure that the cost savings would be passed on the consumers. So it's still on the table for discussion, but I really worry about that part of it.
Thank you.
Yes, Laura.
Hi, Governor. So to go back to, actually, I think this is probably a question for Mr. Kinsley, but I'm not sure. To go back to what you were saying about boosters being, our number one method and shots. We've heard a lot on the national level about the possible waning of immunity protection from some of these boosters. And I guess I'm wondering, as somebody who takes care of an elderly parent, is this really the time to be letting our guard down?
So number one, we are making sure that we increase our protection and increase our guard by continuing to push for vaccines and boosters. This is an important part of the personal responsibility that we're talking about, and businesses encouraging their employees to get vaccinated and boosted. But I'll let Secretary Kinsley address that.
The latest science that we have continues to support that boosters provide robust protection against severe disease leading to hospitalization and death. We are watching that closely. The CDC continues to measure every month as we get further out from where boosters began, the understanding of that protection. But a second consideration will be not just the waning immunity, but when is the right moment for another booster, if at all. You would want it likely more aligned to when there's an eve of higher risk of exposure because of increased transmission. So those are the conversations happening right now, and we're watching that very closely. But as the governor said, this is keeping our guard high by making sure we're prepared and continuing to push people to get boosted.
Do you have a time frame for when you expect to see the BA2 variant become the dominant variant in North Carolina?
We will have to watch that. I mean, don't know exactly. We have tended to trend 4 to 6 weeks behind what we're seeing in Europe, but there's a lot of variables here.
We've heard on the national, well, actually, Congressman Butterfield's holding a press conference today to talk about trying to get the federal government to continue supporting COVID prevention efforts and relief efforts. Are you concerned about, or is there a problem with dwindling of federal resources to sort of cover all the things that the state's been doing for the past 2 years?
I'm actually going to have Dr. Consagra come up, but first I will say, staying prepared and having these stockpiles is incredibly important. I'm most concerned about our supply of testing in the private markets and the unique ability of the federal government to maintain those levels of supply by pushing and propping up that market. And so I hope that we will see that funding come. We need it to stay prepared. This is not the time to take a step back. But Dr. Consagra?
Thank you, Secretary, and thanks for the question. As the Secretary mentioned, we are incredibly concerned about what the lack of funding at a federal level means to us at a state level. We know certainly things like vaccine allocations, purchases of antivirals, those things need to happen in advance with manufacturers to make sure there is enough supply. And we are already aware that that will result in a reduction, for example, in monoclonal antibody availability by 30% starting next week. So we are starting to see those impacts right away. Another one of the immediate impacts is that providers will no longer be able to bill through the HRSA uninsured program. And so there again, providers across the state have used this program to provide care for those that have needed it and that have been uninsured. Hundreds of millions of dollars have gone into North Carolina providers to provide this care. And there again is another immediate impact that we will expect if there is not more funding back to the state. So yes, concerned, and we'll see some impacts.
Thank you. And one last question for the governor. As you probably are aware, the U.S. Senate unanimously passed a resolution to go permanent daylight savings this week. We've had some talk about that in our state as well. What's your take on that?
I probably would just rather go back to standard time and stay there.
Why?
That's what sleep experts say that you should do. But that hasn't been my most pressing issue this week. I was pressing the day that we actually leapt forward. It was pressing for about 48 hours, but I'll let Congress deal with that. And I want to say on the federal funding, it is crucial. If we've learned any lessons, is that we have to be prepared. And the way to keep this virus at bay is to be ready for it. And I was on a call with the White House and other governors across the country the other day. I made this point. Federal investment keeps the production of tests and treatments high, which is what we want. We've seen how fast a surge can come. So we have to be ready. And already they've talked about, because Congress failed to pass the additional funding in this last legislation, we've already seen a 30% reduction in monoclonal antibody treatment that we receive from the federal government. Now, we can manage that now because things are low, but that's the kind of thing that we really can't afford. So you're going to see us continue to push for federal funding because it's part of being ready. Yes?
Hi, Governor. So many people across the state got their boosters roughly about 6 months ago. And by that 6-month rule, a lot of people would be eligible for another booster kind of in the springtime. Is there any plan to make a fourth vaccine available to this population?
So I know that we're working closely with the CDC and they are monitoring all of this, but I'm going to let Secretary Kinsley to address that issue.
And I'll have Dr. Consager come back up as well, but just to emphasize that right now, there is not guidance from the CDC for a fourth shot. We remain that after your booster, you are up to date with your vaccine. So getting that shot is what you need.
Thanks, Secretary. Yes, the data around an additional booster dose is being studied now. We know that the FDA is looking at this with data that has been submitted by Pfizer, and as we look at what is happening across clinical trials. Now, there is recommendations also for immunocompromised individuals now, and that's a little bit different, increases the number of doses that somebody might need as their primary series, and then a booster leading to 4 shots for those individuals right now. But for the general population, that is where we are still waiting on the data. We will see what FDA and CDC recommend and then take our cues from them. Thank you.
And Secretary Kinsley, you said that the number of positive test results is not necessarily going to be a primary indicator for the state moving forward. I'm wondering what was sort of behind that decision to almost downgrade the significance of the testing system?
So, over time, we have seen testing really modernize and become more and more available, which is wonderful, including the fact that many people can get access to rapid at-home tests that are available for them, which gives them information about their risk and also gives them information about how to move through the world for the next few days. And so that's important information for them to have, but it's not information that we readily have or is reported to us. We have looked at the potential of how to get access to that information. Unfortunately, it's not something we can do with a great deal of confidence and quality. It's still the cases that are reported to us through other mechanisms remain an important metric for us to see trends and disproportionate impact on certain groups, but that total number of testing and collecting all of those tests is not the most valuable metric right now.
And Governor, quick question about Ukraine. Things are obviously ramping up in Europe. The U.S. is providing significant aid to Ukraine and NATO forces. I'm wondering if there have been any discussions on a state level of providing any assistance to these forces overseas, and any message you have to families of the thousands of troops from Fort Bragg that have been deployed over there.
North Carolina stands with Ukraine in its fight for freedom and against tyranny from the Russian invasion, Putin's war. I've already issued an executive order requiring state entities to do away with contracts and agreements and products with Russia to send a strong signal. We've also re-upped our efforts to support families of troops that we know are overseas right now and giving them a litany of resources from the state. I also know my own church and others are sending aid. Private companies, churches, nonprofits are sending aid over, and I strongly support the federal funding that's occurring now to help Ukraine in its efforts. Yes.
Hi, Governor Avi Bajpai with the News and Observer. I was wondering if you could talk about, you talked about today the next phase of this pandemic. Is North Carolina closer to reaching the endemic stage of this pandemic, and how far are we from that?
So I'm going to let health experts and maybe a doctor talk about that stage. I know that we have turned the corner on this pandemic, and we believe that the worst is over. Today is about how we approach the future, the plan for preparing, informing, but also encouraging individual responsibility and empowerment here. I'm, however, going to leave those terms up to, so I'll turn it over to you, Secretary Kinsley.
Thank you. As the governor said, right now we are focused on how do we ensure that we are prepared, and we have built those tools to really be able to manage this disease in a very different way than we could before. We know that this virus has been able to throw curveballs before, which is why staying vigilant is important for us. The terminology of endemic is something that will really be about looking backwards to seeing over time how this is being managed and if we are getting into more of a steady state. So that is yet to be seen.
Is just to follow up on that, I think the CDC talks about broad immunity as one of the criterion for reaching that stage. Is that something that is that sort of the main metric going forward to determine when North Carolina is at that stage or at that point?
Broad immunity, as we have outlined, is a key factor in being prepared, and we know from data and sampling of blood donations that 94.3% of North Carolinians have some level of immunity to this virus. But it's important to remember that variants, as they shift, can evade immunity and can make that immunity not provide the same protection as it would for other variants, which is why it's not an only metric, and there isn't one metric. We have to look at all of these things in concert.
Okay, thank you.
Thank you.
Okay, we'll now go to the phones for any media questions there.
Our first question is from Richard Cleaver with the Winston-Salem Journal.
Yes, Governor Cooper, Secretary Kinsley. I was going to ask a question about if there's any concerns about the low vaccination rate among K through 12 students, especially considering most school districts have gone to the mask optional status.
We are encouraging vaccines for everyone who is eligible, including children, and I'll turn that to Secretary Kinsley.
This is so important. We know that vaccines provide the best protection against severe disease leading to hospitalization and death. And we also know that kids can and do get COVID and tragically sometimes end up in very severe situations. So getting folks vaccinated is incredibly important. But overall, we also know because of the vaccination levels in communities and in households and because of the impact of COVID-19 on children that kids and schools in particular are low risk settings. And so that's the balance. We want to encourage parents to talk to their pediatrician, to take their child in to get vaccinated.
Next question, please.
Our next question is from Michael Perchek with WTVD.
Good afternoon. We have schools and local universities going on spring break over the next few weeks. Some have already begun doing so. That, of course, is coinciding with an increase in cases internationally and a lot of mandates and restrictions being dropped domestically. Was there any thought process looking at the schedule to maybe delay some of these decisions or announcements until potentially early April when most students had returned? I know our local universities typically have seen some sort of spikes when they do return from either a summer break or a spring break, just from having so many students traveling and then being in tight areas with one another for prolonged periods of time.
So it's been a while since we've had any state government requirements or mandates. What we've been encouraging and what we are specifically encouraging today is personal responsibility and empowerment. These students can be vaccinated and boosted to protect themselves. If some of them have particular issues that they're concerned about, they could continue to wear a mask. So we are at this point in time, because our numbers are low, we've got better metrics to try to determine where we are and how to prevent things. And we have tools that we haven't had before that will help us manage this. Secretary Kinsley, would you want to say something? Okay. Next question, please.
Our final question that will conclude today's media briefing is from Claire Donnelly with WFAE.
Secretary Kinsley, thanks for taking my question. It's Claire Donnelly with WFAE. I wanted to know how exactly the data dashboard will look different, so there won't be any case counts or test positivity rate posted at all, or just a weekly look back at those numbers? Thanks.
Sure, thanks for the question. And we'll be putting out more information specific to the dashboard and the makeup. Right now, what we're doing is we're updating the first page of the dashboard to align to the metrics that we just discussed. We'll be updating them weekly. For a while, we'll continue to provide daily updates on some of the more deeper pages of the dashboard that many of you may be familiar with around case rates and, of course, vaccination rates, breaking down that information demographically, geographically, et cetera. And so those changes will come over time, but right now the front page of the dashboard will align to those metrics that I just spoke about. We'll be rolling those changes out next week.
Next question, please. Was there a follow-up? Okay. Not a follow-up. Okay, great. Thank you all for being with us today.
And you were just listening in on a joint press conference with Governor Roy Cooper and the state health department there as they give an update on COVID-19 and North Carolina's new response to the virus. So we learned a few things today. First, the health department is going to start reporting COVID-19 metrics weekly, but the metrics that we see on the website and the metrics that they report are going to start changing. You know, we've been talking a lot about the percent of tests coming back positive in North Carolina as a way to know where our state stands in the fight against COVID-19, but they're not going to focus on that anymore. Instead, they are going to focus on 7 metrics. I'll list them for you now. First, wastewater surveillance, which we've been talking about for a while here in Mecklenburg County. They're also going to look at COVID-like illnesses coming to the hospital and hospital admissions, so the people in the hospital with COVID-19. They will continue to monitor how many cases are in our state, so the case trends there. Also, the number of people who have been boosted with a booster vaccine for COVID-19, the prevalence of variants, and we were just talking about the new Omicron subvariant this morning, so they're going to keep an eye on new variants such as that, and the CDC community level, which is a level that the CDC puts out nationally that labels certain states in red, orange, or green as far as community spread. So we heard about that. That's how they're going to be monitoring COVID-19, but they also gave us 4 core areas that they're going to be looking at. A lot of this is based on individual responsibility. So you heard this from the governor, you heard this from Secretary Kinsley saying they want to empower individuals to make responsible decisions and choices when it comes to COVID-19. They also want to maintain health service capacity. So how able are hospitals and health systems to respond to COVID-19. They want to continue to collaborate with local partners, and they say they are going to prioritize equity. So these are North Carolina's new core 4 areas that they will be focusing on. We also heard a bit of the economic side of COVID-19, which we certainly know has been an area impacted in our state. Governor Cooper said that we are back to pre-COVID employment numbers, but he knows that families and local businesses are still being affected by COVID-19, so the response will continue there. Thank you so much for tuning in today. As always, we have the latest information on WBTV.com. You can see a breakdown of this press conference that you just watched. You can also find the latest on COVID-19 numbers and stories if you just click on the Vaccine Team tab at the top of the home page.